The proportion of women who choose to undergo bilateral or double mastectomy for unilateral or single-sided breast cancer is increasing in some geographical areas. Since patients are often interested in this procedure, I have collated a list of 5 questions which I think are crucial for women to ask before they make a decision for double mastectomy. These questions will be answered with research data and available evidence on the subject for general medical education. But it is important for each patient to consult her doctor about her specific circumstances and treatment planning. Here are the primary questions that you may wish to ask. There may be others which may arise in the course of your conversation with your doctor, but my goal is to offer a foundation of knowledge on which you can build in order to make your decision. Do you have any other questions? Please list them in the comments section and I will respond either as a reply or in a video. Let us look at these questions one at a time. You may wonder why the question regarding a high-risk gene is listed as the first. It is because women diagnosed with breast cancer who have the gene are at higher risk of developing local recurrence and may wish to consider double mastectomy. But I do wish to emphasize that not all women diagnosed with breast cancer have high recurrence risk. In fact, most women do not. Of the approximately 2.3 million annual cases of breast cancer worldwide, 5 to 10% are estimated to be attributed to a genetic predisposition. The predominant variants are the BRCA1 and BRCA2 genes. This other article provides a more comprehensive list of gene variants. Apart from BRCA1 and 2, women who have been found to be carriers of TP53, CDH1, PALB2, PTEN, STK11, those with a strong family history or chest radiation before the age of 30, may wish to consider double mastectomy as a therapeutic or preventive measure. There is insufficient evidence to support double mastectomy for the other gene variants. So, in summary, to answer this question, individuals with a strong family history of breast cancer or have been found to have any of the high-risk genes listed earlier may wish to consider double mastectomy as their form of surgical treatment or as a risk-reducing procedure against breast cancer. Please watch these other videos for more details. For this video, I will focus on women who do not have high-risk genetics. For these 90% of women who do not carry the pathogenic gene variant, an expert panel who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference believe patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results. We will discuss the research data that provide the evidence for this statement as we answer the next question, which is whether double mastectomy provides better cure rates. Let's take a look at the available data. We will recall that 90% of women with breast cancer do not have the high-risk gene. For these women, the next 2 studies would be applicable. The first is a meta-analysis comparing breast-conserving surgery with radiotherapy and mastectomy. A meta-analysis is a statistical calculation of the combined data from several studies. Of a total of more than 1,800,000 women, this team of doctors led by Dr. De La Cruz-Cu from the University of Massachusetts found that breast-conserving surgery is associated with improved overall survival compared with mastectomy. The results were similar in this study performed by doctors in South America, where their meta-analysis demonstrated significant benefits of breast-conserving surgery on overall survival compared with mastectomy. In certain types of breast cancer, bilateral or double mastectomy has been shown to be associated with significantly increased risk of breast cancer mortality relative to lumpectomy with radiation. So, does double mastectomy provide better cure rates? There is no definitive evidence to support the notion that double mastectomy provides better cure rates for women at average risk of breast cancer and who do not have specific gene variants. Breast conservation treatment confers either comparable or superior survival rates for women without high-risk genetic mutations. In medical research, survival rates are used as a surrogate for cure rates. The third question to ask before deciding to undergo double mastectomy would be if it prevents local recurrence. This team of doctors, who published their work in 2024, reported that there was no significant increase in the overall recurrence rate for patients with breast cancer who underwent breast conservation treatment compared with those who underwent mastectomy. In this separate study published in 2026, 8.5% of women who underwent bilateral mastectomy were noted to have local recurrence. Therefore, the evidence shows that double mastectomy does not guarantee freedom from local recurrence. In standard risk individuals, breast conservation treatment has not been shown to be associated with increased local recurrence compared with mastectomy. I wish to reiterate that the situation may be different for women with high-risk genetics. We have already looked at local recurrence for double mastectomy. So, in this context of SAFE, I shall be discussing data pertaining to post-operative complications. Let us now look at the data to answer the question if double mastectomy is the safest operation. Lumpectomy or partial mastectomy, which are synonyms for breast conservation treatment, are associated with complication rates of 1.74%. Simple mastectomy, that is without reconstruction, is associated with a postoperative complication rate of 4.04%. While this article reported that surgical complications for bilateral mastectomy with reconstruction occur in between 15% and 34% of patients undergoing the procedure, more recently, in 2026, this team of doctors reported that their overall surgical complication rate was 58.9%. If we refer to SAFE in the context of surgical issues, this is a summary table for the reported postoperative complication rates. We have already discussed the comparative survival rates and local recurrence rates with breast conservation and mastectomy. Breast-conserving surgery is associated with the lowest surgical complication rates, while mastectomy with reconstruction has the highest reported complication rates. This is the fifth and last question we will explore in this video. Does double mastectomy provide complete peace of mind? Many women feel that they do not want to take chances, and so decide to undergo double mastectomy. In this article, CPM refers to contralateral prophylactic mastectomy, which is the removal of the unaffected breast, and is usually performed at the same time as removal of the cancerous breast. However, these researchers found that many young survivors had physical and emotional challenges for which they were unprepared following CPM. Based on this report, an estimate of about 10% of women regret undergoing double mastectomy. Of women who had undergone contralateral prophylactic mastectomy, about 50% felt physically less attractive, less sexually attractive, were dissatisfied with their body and surgical scars. We will recall that about 8.5% of women who undergo bilateral mastectomy experience recurrence. Therefore, double mastectomy does not guarantee freedom from local recurrence. The research data pertaining to this question of whether double mastectomy provides peace of mind demonstrate that for women who underwent double mastectomy for this perceived reason, about 10% regretted their decision, 50% had body image issues, and 8.5% experienced local recurrence. While I have covered what I feel are the most common and important questions for women who are deciding their surgical treatment for breast cancer, I am sure there are more questions you may wish to ask. Please enter them in the comments section or submit a request at the Just Medicine website so that I can collate data relating to them. Thank you very much for staying until the end of this video. As you know, in this channel, we explore data and evidence supporting recommendations for the surgical treatment of breast cancer. Kindly click on the like button, share, comment, and subscribe as a signal for more similar content. I hope you will join me in my other videos too. Until we come together again, take care.